شكرا لك غاية الهرمودي على
Thank you,
هذه
Ghaya
الجلسة.
Harmoudi, for this lovely session. Ladies and gentlemen, the fifth session of Success Stories is now taking place, in which Dr. Khalid Lootah talks about his success story. Please go ahead, Doctor. Greetings, everyone. First of all, I am honored to be with you here on this brilliant platform. I would like to talk to you about a success story more than myself, and this story I am personally proud of because it is a success story that was not expected, but happened because of the pandemic that we all went through. To begin with, I would like to introduce myself. I am an ophthalmologist in the Dubai Police General Headquarters. I think you are wondering what an ophthalmologist has to do with the coronavirus. After graduating from medical school, I had to choose a specialization for 4 years, and I chose the specialization of health authority. So I was referred by the Dubai Police to the health authority to study the specialty of ophthalmology for 4 years. These events happened, and after the first year, the passion of volunteering started in me, and I started to get involved in this field gradually in the health authority, in the hospitals, and the Noor Dubai Foundation, because it specializes in ophthalmology. So we accomplished several volunteers achievements. And in the first year, thank God, even though I'm from the Dubai Police, I was elected to be the head of youth council in the health authority during the first year. And there were among about 2,500 people that were beginning of Youth Council Foundation at the government level. This was the first year at the government level. Until now, I remember the date of 29th of January 2020, which was the first case of COVID-19 in the UAE. Of course, I'm talking about the COVID-19 then, not now, because COVID-19 was way different before. There was fear and panic, and nobody knew what was going on. This situation was completely different from now. For everything I'm talking, Now I want you to go back to the mindset that we were during that period after the first infection case. Of course, equipment were brought to the hospitals at the health authority level, Rashid Hospital, Latifa Hospital, and others, but the equipment were not at the level that expected. None of them expected what was going to happen. We were talking about the United Arab Emirates, comparing it to big countries such as America and Great Britain, which even them were not prepared. No matter how well equipped we were not able to deal with such a pandemic for the first time in the right way. There were preparations at the administration level, but the young people were not involved in these preparations to a great extent, because it was a slightly higher level. It was at the departmental, sectorial, intensive care or other levels. However, when the pandemic arrived and the numbers started to multiply by 10s, 20s, and 30 and 40, when I'm here, a daily basis, then a state of tension and panic started. And I'm not talking about hospitals, but rather about the people themselves, because nobody knew what was going on, and even we didn't know what was going on. There was fear. Would you please be able to go back to the previous slide? Keep this slide, please. Back in March, the Youth Council went to the executive director of the health authority. There was a file for volunteerism within the file authority, but it wasn't activated. So we saw an opportunity for volunteers to serve in this pandemic. And here I'm talking about the period before the UAE Volunteers campaign and before the official campaign for volunteering in the pandemic was launched. It was about 3 or 4 months before. So we went to him and we said that if the file is available, we asked that can we assign this to the Youth Council, and that we would get this and try to recruit volunteers to help in this pandemic. So he told us that he wouldn't mind, and he were busy with other things. You have a week or two to register 1,000 volunteers, and we had 2 weeks to register 1,000 volunteers in the platform, and the platform was available. It wasn't activated, so we launched and activated it at the health authority and Dubai levels. And thank God, in the first 10 days, 2,500 volunteers were registered. In the first 10 days only. Of course, we didn't expect this number, and we were very happy with this number, but it caused us some tension because we were a group of 10 young leaders. We were responsible for 2,500 volunteers. We did not know this large number of people enrolled. So you have to take into account the specializations, the achievements, and how do you benefit from? That is the challenge. The challenge is not the registration of volunteers. Even when we spoke with the executive director's office, we told him we had 2,500. He felt happy and he said, assign them tasks. And then we said, where we dispatch them, how? We cannot give tasks to people randomly. So the most challenging part was the distribution and sorting, and those queries alone took about a week or two. Here I'm talking about categorization of volunteers to two: the health authority volunteers, who are the same health authority employees, because when the pandemic started, a lot of jobs stopped, including dentists who closed and their clinics when the pandemic started at the government and the health authority level, because we had over 400 or 500 dentists who were all registered in the platform and all stayed at home, and the administration also stopped working. And I'm talking about the beginning of the pandemic, where everyone stayed at home and no except the police, security or doctors, that is just the basic things, while the others were all at home. So these employees of health authority registered on the platform in addition to the other volunteers. Now I'm talking about those who were from the health authority, including dentists, orthopedists, and those types of physicians. As you know, we don't have the benefit of those people because we don't need their specialities at this time in the pandemic. At the time of the pandemic, we needed critical care services, emergency services, breathing apartments, etc. However, we saw an opportunity for those people because at the end of the day, they are physicians. Whatever their specialty is, they are physicians, and they have medical training. And by taking the right course, we can benefit from that. So we did a crash course with the critical care department, and we had 2 weeks to train all of those doctors, like orthopedics and ophthalmologists, and I'm one of them, and I did not know anything about coronavirus, in addition to all of the other specializations. So we included them in these courses. And after 2 weeks, instead of wasting a waste of 500 or 600 doctors staying at home, we had 500 or 600 doctors that we can benefit from. So we used them and we benefited from them. For example, 500 dentists were taught all the swabbing and nose exam procedures, and they were distributed to all the courses. Please display to the next slide. By the end of April, we had 4,500 volunteers registered. 1,500 in the medical field. We're talking about 1,500 volunteers, doctors and nurses who don't get paid or anything. There was a huge shortage. Public hospitals are looking for doctors and private hospitals are looking for doctors. Everyone was looking for doctors, and they were looking for nurses. We had 1,500 people who wanted to help us, but no one was reaching them. This platform was an opportunity for them to reach them, So we benefited generally, and we had 2,900 volunteers in administrative areas, and now administrative and public volunteering. Even before the platform, we started to benefit from those people, because when the pandemic started, if you remember, all the countries closed their borders, and the citizens who were abroad came back to their countries, and all people who returned were afraid. So we put them in lockdown hotels as soon as they arrived. I don't know if there was anyone who knew about this or not. But there were isolation and confinement hotels. I don't know if you knew the details or not. All these incoming travelers, any traveler that came into the UAE would get a call, and that call was from us, and that is our volunteer team. We would call every traveler. There is a list from Dubai airport and all the airport in Dubai about every single person arriving in Dubai, because we would get the list in the next day, which was listing thousands of travelers, and we would call them one by one to check their health and ask them if they have symptoms and what hotels they are staying in and if they needed anything, and we would ask them not to leave the hotels and give them all these instructions. These instructions were not distributed at the airports before, because all of these events happened in the blink of an eye. Before that, there is no publications and localization watches. This achievement, which was even before the platform, which they asked us to help them for just for 5 days, they put us in this task and placed us in the innovation center, which we turned into a call center, and then they prepared phones and tablets for us, and they gave us 10 mobile phones, 10 boys, and they told us to help them for 5 days. We said, like, okay, we will help you for 5 days. The 5th day, they brought us 20 additional mobile phone because they liked our efforts, and the lists started to increase and increase. I'm sure that this achievement, I knew, and I was sure that it first provided a sense of security for people coming from travel or from traveling who were afraid, and secondly, I don't know how many other cases were managed to avoid, because if these people hadn't had these instructions, they wouldn't have left their hotels and homes, and I'm sure that these instructions helped us to reduce some of their infection cases. Please display the next slide. How did you ensure that they followed instructions? We didn't have apps or tracking bracelets at that time. We were calling them every 2 or 3 days, but in terms of our 100% certainty, they were not out, which we couldn't do unless we called them back, and we were using the resources that we had at the time, and that were in the app development stage. We were at the app development stage, and so on and so forth. The beginning of the pandemic, we had 20 hotels of isolation in quarantine centers, and every hotel was full of people from abroad, whether they had been in contact with infected cases or were infected themselves. And there were hotels just for the infected subjects, because there were no other resources at that time. We were in such a hurry in those hospitals that there were no shifts, so the nurse whose shift was 8 hours became 12 hours, and the 1,232 volunteers from outside the health authority were many, and we did not expect all these numbers, and the volunteers came every day, boys and girls, and I'm talking about girls, at the same time of the national disinfection program, the time of lockdown, that is. At a time when no one was allowed to go out, and their ages were young, 18, 19 and 20 years old, and this indicates a great sense of loyalty, and not only citizens, not only locals, but the residents also. In that fear stage, when a girl or a young boy of that age, with their parents' permission, were volunteering to go out and help all that time, or the peak of corona pandemic, this is a great thing, and we are proud of these numbers. We didn't expect that 1,200 people would expose themselves to the risk of infection. And of course, we were following all of the procedures. Even in these places, we were trying not to gather them in one place. But there is the fear factor. Even we doctors, we were afraid, because it is an unknown disease, and we did not know, like now, the information about the disease, like now. Now the severity of the corona has eased somehow, and the procedures are known now. Constantly changing, things are constantly changing to the better, and even the quarantine and the isolation period and the length of the quarantine was constantly changing, because the issue was related to the new disease, and at that time we were 1,200 young men and women, including school children. So we had For medical specialties, we had 683 volunteers, 365 physicians, and these are the physicians that we didn't need at that time, like the cardiologist, the orthopedist, the dentist, who all closed their clinics and stayed home, but these doctors helped us a lot, like the dentist at the end of our supervision regarding the volunteer file, which was assigned to us in 2020, March 2020, and we handed it over the end of December 2020. At the time of the low peak of corona, things became easy, and there were applications, and the participation of the private sector and the health authority brought in doctors and nurses from abroad who had started before us with such procedures. But during this period, we helped them on these issues. For example, they did more than 30,000 nasal swabs, which were done by dentists, and these are not doctors who knew about corona or other issues. The nursing consisted of about 5 volunteers, of course. So paramedicine had 129 and dentistry 184. There were no pharmacists, but they helped us with something. I'll tell you about it later. Please display the next slide. The total volunteer hours are 232,000 hours, which were recorded from the beginning of our mission, which is 9 months period, 232,000 total hours for all volunteers, and those outside health authority are 80,768 hours. We are talking about the volunteers outside the health authority. They are employees. So you can't force them to do this work because it's not their job. For example, my job is at the front desk. You can't ask them to work in the call center, but at the end of the day, they have done a job that is not their job. That's actually why we call them volunteers. The financial savings that we had at the biggest accomplishment that we are proud of, which was headed by a group of 9 young men from the Youth Council, despite we had no administrative experience, no financial experience, nothing. I am an ophthalmologist, and before that I'm a physician, and before that I was a medical student, and I don't have any training in administration. And I have no management background or no communication background, no relationship background, but we succeeded to make connections with private sector hospitals and clinics, and we benefited from them, from their nurses and physicians, even though that we had no experience in the area. We saved an amount that is 7,200,000 dirhams. So we saved that amount for the government during the period, the pandemic. This means that 7 million were saved by a group of 9 young people. This is a very large amount in 9 months. These 7 million were used in 1,000 other areas. In thousands of other areas, such as national disinfection program, national examination, and many other things. But the amount of 7 million has a certain process of calculation so that the specialists estimate how many dollars per hour. So we adopted the minimum rate of our calculation, and the outcome was 7 million. We covered 27 sites, and I mean the group of 9 young men from the Youth Council. We were covering 27 sites, including health centers, hospitals, examination centers, in vehicles, quarantine and isolation hotels, the command and control center, and the field hospital. We are the ones who covered the hospitals with doctors and nurses from volunteers and labor sites, and our volunteers are the ones who were going to check them in the area of Naif and Al-Rifa. So 27 sites. The major challenge was there was 4,000 volunteers supervised by us, because we didn't put them in the specific place and leave them there, but there was always a shifting for the volunteers. So we used to assess the need every 2 or 3 weeks. For example, in Naif and Al-Rifa, after 2 or 3 weeks, they will be shifted. The airport, for example, after a certain period of time, they serve there, and then they get shifted to somewhere else. There is always a continuity for change in their shifts and their places, and that was a good thing. And I remember the peak of COVID when there was a big shifting pressure and a great number of cases. We being this group used to go home for about 5 hours to rest and some sleep and come back again, even though we were back in our homes. We were not allowed to see our families, our children, our fathers and mothers, because there was a fear of infection, because it was transmitted so fast. We did not know very well the mode of transmission, because the infection could be transmitted through the papers, and the papers that we dealt with at the airports, they were receiving the same from the arrival, wearing gloves. These are the other achievements of volunteers. We talked about the call center, where from the beginning of the call center until the closure and the start of the application or the app, we made 400,000 calls. Even the manufacture of protective face masks. So they make face masks. In the end, we made 8,900 masks at absolutely no cost. On our part, organizing blood donations campaigns was constantly present, even in intensive care and evacuation examination for the departed, as there were evacuation trips to the countries of India, Pakistan during that period of time. So there were examinations required by their countries, and we were carrying them out. Intern doctors are those who are between graduation and specialization. That is, they do not have a specific specialization. So even those stayed at their homes, because there is no training period in hospital, but we benefited from them as well, as we contacted the Medical Education Authority and told them that it was an opportunity to learn in the pandemic. So 117 doctors helped in these hospitals. This was another achievement. Each individual was doing his best. Even school students were coming to volunteer. For example, they were coming to us even in the Innovation Center, Ibtikar Center, which was the place of the health authority, as we were responsible for any volunteer related to healthcare sector in the Emirates or in the Emirate of Dubai. So we were responsible for this file. And they brought us paper and other things. They were 16 and 17 years old, but we could not expose anyone to the risk of infection. But they wanted to help us so much that they would come to us and call us and send us letters just because they wanted to help. I don't think that without those efforts we would have been able to achieve those results as fast as if we have approached a different plan. Because there was a big demand. The airport, we want 10 volunteers every day, and 15 volunteers here, 15 volunteers there. So there was a demand. Therefore, the young people have energy and they have achievements. We did not expect that we had the capability of achieving those things. The young people, they have energy. They could handle such large file. Even the first time they received the file, there were people saying, we're just young youth council, we cannot do this. And the youth people or young people were energetic, enthusiastic, and they believed that they could do this. And all of them are boys, 20 or 21 years. But I am very confident that the youth, if they handle anything, if they accept anything, and they have the motivation, so they are capable of achieving big achievements. And this is something that I'm very proud of, because it was achieved in the coronavirus pandemic. Does anyone have any question or comment? Is there any person among the attendees who was a volunteer with us in the health authority during the pandemic period? Hello, my name is Joud Khattab from UNDP Syria. First of all, thank you for the speech. It was a very inspiring, but I would like to ask you, you had a lot of volunteers. What was the psychological factor that they were going through during that period of time? Because in every country, there were volunteers who were working during the COVID period, but they were suffering psychologically in some cases. Well, I was afraid, as were the volunteers around us, and the group of 9 young people were managing the case. In fact, there was a constant fear, a continuous panic, and I said earlier, there was a fear even from the papers we were working with, and I used to finish my shift and go for 5 or 6 hours so to see my family, my mother and my father. So there was fear, because we don't know a lot about this disease, but we were focused about work. We were focused on work, 6 or 7 hours. We don't think about something else. You would start your shift, you'd be fearful for the first maybe half an hour, and that's pretty much it. You would get along with whatever service you are providing. So to say the least, there was fear, there was hesitation in the beginning, but once you delve in it, they handled those 9 people that I told you earlier about. They were contaminated 4 times each. One of them was in quarantine. The quarantine period at that time was not only 5 days, but you had to stay in quarantine until the swab result was negative, or the test result was negative. So the nasal swab result for that person was positive for a whole month. And after that month, a week later, he came back again. There was fear, but they wanted to see their accomplishments in the field, and they wanted to see the results of their work immediately. I think this is the motive that made them overcome the things that they went through. Yes, please. I'm a pharmacist. I had just arrived in the United Arab Emirates at that period, and had been working since December in the call center, not in a call center, but in the customer service department in the Dubai Health Authority. And we were getting at least 100 calls a day from people who were crying, people who were breaking down, and people who didn't understand. Yes, indeed, it was a lot of such calls, but we were paid, and honestly, you did a great job. And is there any work for the volunteers right now? Yes, there are. Of course there are. I finished my training period with the health authority and went back to the police, and the platform now we created is still working. It's still there, and it's taking volunteers. Thank God. It is a continuing success story for the health authority. Many thanks. May God bless you. The work that you have done is really great work, and may God bless you. I'm majoring in electro-engineering, and I always feel that it is difficult in this major to find volunteering opportunities in the Emirates or the UAE, as I don't know which volunteering field I can belong to other than health field. But thank God the pandemic ended well. But the health field is the easiest field for a person to find volunteering areas in which to help people. Frankly speaking, there are more opportunities to volunteering outside of the health field than the health. In the UAE, we have an official platform for volunteering, which is Emirates Volunteers. It's true, I have registered, but I don't know, maybe I haven't found the right opportunity yet. It may be, but you access the platform, you will see the large number of opportunities that exist. But the difficulty is, as I said, to find something through which you feel you can rely, help. You can try opportunities, and if it doesn't work for you, you can still try to try other opportunities. Not necessarily the medical background, but we also lack the administrative aspects, such as human resources and so on and so forth, because we hadn't the experience in that. But we learned it through this volunteering. So you may find something else to learn, and you may find that you have the passion in these things. Greetings. Thank you for the presentation. In fact, or the fact that the corona pandemic has been a challenge for everyone, and you have managed the volunteerism in a very excellent way, and it's an excellent experience. Everyone struggled to make the right decisions and couldn't manage the risks in this way that they felt was safe. I was hoping, God willing, in the times to come that we would hear and about what benefit you got out of this experience that was full of fear, challenge, and hard work. So I hope you show us some of the things you discovered, later. The knowledge must have been minimal. Then the knowledge started to grow, and then the decisions started to be made better and better. If you can show us these things like insights and enlighten us some of the little things that we miss, how would you be able to take the decisions, things that you have learned that made you take decisions better and better and better gradually with work? So the more we delve into things, the more insight we have. Again, thank you very much for what you have done. There are a lot of things that we learned that are not shown here in the presentation, but the UAE went through two peaks. The first stage was the confusion that occurred, and then the second peak, but everyone in the UAE felt that the second peak went more smoothly because there were a lot of things we benefited from the first stage, or from the first peak. Even after the first peak had passed and the pressure had submitted or decreased slightly, there was continued development of healthcare facilities, and there was a recruitment of physicians, nurses, trainings, and all those things were constantly there. We did not have departments before in the first peak, and things were put in place in the country. During my time in Syria, I was with the Red Crescent, which also helped us during the corona pandemic, and I know the magnitude of the difficulties that a person has to face because they are not afraid for themselves, but rather afraid of infecting other family members. Exactly. Can you please go to the previous slide? We lumped them all into the support medicine department, the nurses, the pharmacists, the radiologist. We put them all in the support medicine category. I'll check the number 101 more. 129 had a role in making the masks, and in the call centers, and other helped us with the administrative issues because it was very massive, like the huge amount of calls and emails we were getting about the need for records. They all helped with those administrative issues. So we benefited from every single person. We had everybody, that is all the volunteers from the youngest people from 15 years old to the oldest volunteer 16 years old. We really benefited from everyone. Are there any other questions? Thank you very much indeed, and have a lovely one. Thank you very much, Doctor, for this inspiring story. Dear audience and participants, we are going to take a short break and we'll be back to complete our sessions and dialogues with inspiring stories with other inspiring people at 2:15. Stay tuned.